Hi everybody, today I'm doing a full microneedling tutorial on my face using a Dr. Pen M8. I'll let you guys start coming on, but today is all about microneedling. I'm going to go over the concept of it, the benefits of it, how it tricks your skin into behaving like it did when it was younger, and we're going to do a full tutorial on the microneedling pen. Okay, sorry I'm running a little bit late today. My husband left this morning just for like a meeting and I forgot my mushroom coffee and I thought I can't start without my mushroom coffee. Hi, for craft's sake. Okay, today is all about microneedling and so I'm doing a full demo. You guys, for those of you who do not know me, my name is Darnell Cox. I am a 56-year-old gerontologist and healthy aging coach. That's what I do. I help people live longer and, to be honest, feel better, function better, and look better while doing it. So that is my jam. Hi, everybody. Okay, I'm gonna get right in this. Whew, I'm a little winded right now. Okay, I'm just doing a little bit of hyaluronic acid. Good afternoon. Squirting this into this little silicone cup. For those of you who do not have my whole skincare protocol, that's how I fit in all of these different types of modalities, everything from microneedling to microcurrent to radio frequency to red light therapy. I did a whole bunch of stories this morning on red light therapy. If you missed that, go back and check out my stories. But this tells you how to fit it all in. All of these protocols, including the microneedling protocol, the younger eyes protocol, the retinoids guidebook, all of this stuff is free and it's on my website, liveyounglifestyle.com. You can click on protocols and you'll get all of these for free. Okay, so I'm gonna start with a little bit of hyaluronic acid. I'm gonna start on my lower face because when I do my eyes, it makes my eyes water. This is the Dr. Pen M8. This is a professional device. It is for at-home use though. And this is a 16 pen cartridge. For those of you, oh, for craft's sake said you did an amazing live yesterday. Yesterday's live, in case you guys missed it, was all about spinal health. Yes, we microneedle our face. This is an outside-in approach to aging, but we also approach aging inside out. And pain and spinal surgery and spinal health and all of those things are super important. So yes, you'll see me talking about hormone replacement therapy and bone density and how to sleep better and how to manage stress and how do you move your body when you get older. All of that stuff, along with Botox and microneedling and effective skincare. It's an inside out, outside in approach to healthy aging. So for those of you who know me for a while, you know that is my jam. If you're new to my channel, I hope you stick around. I hope you follow because there's a lot to learn about aging. And that is my specialty. Okay, so I'm going to start with, for those of you who know, like the whole guidebook that I have gives you all of what you do at first, right? Safety first, safety first. You can DM me or comment when I post this to my main feed. I'm going to try to post this whole demo to my main feed today. I got away with it last time. It wasn't flagged last time on Instagram. So I'm going to post this to my main feed, I think. Let's see if I say anything like that needs to be edited out. If not, then it's just going to be for my subscribers. But this is the microneedling protocol. It's free. It's absolutely free. It gives you all of the needle links, how I microneedle my face, the different needle links. You change the needle links when you microneedle because your skin is not the same thickness in different areas. Lisa asked, did I numb first? I do not numb first, and the reason is because you're only going, well, I go anywhere between a 0.25, quarter of a millimeter depth to, like, let's say I'm doing my chin, up to like a 1.5. 1.5 millimeters is not super deep. Yes, it hurts. You get used to it, Lisa. And when I use a numbing cream first, I go so deep that it's like, oh, I can't feel it. I'll just go over and over and over again and I eat my skin up. So you get used to it. And once you get used to it, you'll realize that the numbing cream is just an extra step to have to wipe all of that off, because you would not put numbing cream and then start microneedling because there could be things will irritate your skin or get in there and cause infection. So you want to wash your skin again after the numbing cream. You want to do a little alcohol wet wipe or do a little spritz of alcohol on a cotton pad and wipe your whole face. You start with a clean thing of needles. Every time you use this, you throw these away afterwards. Do not reuse these needles. And I'm going to start with I'm going to go on a speed of 1. Let me just get my needle depth first. Hold on one second. Righty-tighty, lefty-loosey. So I'm going to go to the left. I'm going to go at a 0.5. I'm going to start with, I'm going to do a 0.75. 3/4 of a millimeter, 0.75. This is a 16 pen cartridge. And I'm going to just do little swirling motions. I've got a nice layer of hyaluronic acid. Let me go back and look at some of these. Is hyaluronic acid the only ingredient you would use when you microneedling with a pen? It's the only ingredient that I would use at home. That's a great question. The reason is because hyaluronic acid, and I like this by Costa Baja, I have no affiliation at all, but I like this by Costa Baja because you can get it in a big pump like this. All this stuff is on my Amazon storefront, but it's also, these links, you guys, are on the free guidebook in here. So I like to print all my stuff because I'm 56 years old and I'm an analog person. But when you download this, you'll see that there's clickable links for everything that I talk about. It's all in this guidebook. It's absolutely free. It's on my website, Live Young Lifestyle. You click on the tab, the menu tab, and drop down and you'll see protocols there. Okay, I'm doing little tiny swirls. I know that some people do microneedle with retinoids and different things like that. I personally do not like that. The pin itself, the microtraumas itself, the needles going in your skin is where the magic lies. It's not in trying to push product deeper, because that's only a depth. Right now I'm at a depth of 0.75 millimeters. So by the time that you push that product in, you're looking at, within 30 days that the skin cells are going to renew themselves and come to the surface. The magic is not in the product that goes deeper, but in the actual trauma itself, the punctures itself that go into the skin. And what that does is when our skeletal muscles, or skeletal muscular, you know what I'm saying, the whole body stops growing, which is usually in the mid-20s, we stop producing collagen at the same amount that we usually did when we were still growing. And that makes sense, right? If collagen is our structural support, much like fiber is the structural support of plants, collagen is the structural support of animals. We are animals. If our skeletal system is already done growing, imagine the amount of collagen it takes to grow a human being and how that collagen needs to be produced by the body in growing that human being. When you're done growing, your collagen level will start declining. That's why it starts declining in your mid-20s. You're done growing. You don't need as much. So when that happens, when we're done growing, our collagen will start decreasing by 1 to 3% a year. And so by tricking the body, by creating trauma itself, it's much like the same kind of wave of collagen that happens when we grow. And that's why when you look at my my monthly calendar that I do, that incorporates all the different types of skincare stuff that I do, like microneedling, microcurrent, radio frequency, red light therapy, chemical peels, all of that stuff, dry brushing, it's all in here. And how do you incorporate that in such a way that it creates a wave of collagen, much like it did when our skin was still growing, when our skeletal muscles, our skeletal muscular system was still growing? How do you do that? And that's in a strategic way, so that you enable your skin to rest in between treatments. You're not doing too much so that your skin gets exhausted, and you're allowing it to rest in between treatments so that the healing And the collagen and elastin gets stimulated and comes to the rescue and really kind of helps to restructure that skin. I'm doing little tiny circles. And that's why, the only reason why I like to use anything on my face prior to microneedling is because of the technique that I use. And the technique that I use is a combination of stamping, but you don't need a hyaluronic acid or anything on your face when you stamp. When you're doing a swirling technique in which you're moving the device slowly over the treatment area, it helps to have a hyaluronic acid on so it creates a slip so that you're not tugging on the skin. Instead, it's just gently gliding over. And let me tell you what this helps, because although it looks like a medieval torture device, it's actually one of the #1 ways to improve the quality of the skin and stimulate collagen and elastin to reduce fine lines and wrinkles, to help the treatment of discolorations and melasma, to decrease pore size. All of this stuff is happening from the traumas that I'm creating and the signals that this is giving my body to create its own collagen and elastin. Does that make sense, everybody? Let me just scroll up for a second. Okay. We've got that one. Can use resveratrol or lactic acid or retinol. That's going to sting like crazy. So think about that for a second. If anybody gets sensitive or gets a little peely or irritated from retinoids, imagine with lactic acid, which is a chemical. I went over a whole thing on Instagram Lives about chemical peels. And lactic acid, although it's not as strong as like a glycolic acid because the molecule is a little bit better, so it's not as deeply absorbed. A lactic acid, I like to use that on more sensitive areas like my neck and chest. MS Jill Clark, I'm talking to you. But when you're putting a retinoid or anything like that, you're still creating trauma. So you're putting something that is going to cause sensitivity and cause irritation into the skin, across that skin barrier. And for me, what I've realized is that sometimes will cause more harm than good, will cause inflammation in the skin, decreases your rate of healing, so it'll take you much longer to heal. And I don't think it's beneficial. I like to use that kind of stuff, lactic acid and retinoids and all of that stuff, which I talk about all the time on this channel. But I like to use those at various times, not right after you've opened up that skin barrier and now you're letting things in that will not only cause irritation, but more things that could potentially cause any sort of infection. And listen, there's a whole thing. It starts with safety first, right? This is completely sterilized. My whole workspace is sterilized. My hands are sterilized. In fact, I want to make sure that I've got sorry, 1 second, you guys. I want to make sure I know I had it. Shoot. That's okay. I've got my collagen. I've got my hair, skin, and nails. I have all my stuff that I need, but I was missing this one little thing, but that's okay. Let's see if I can, oh, here it is. No, that's okay. I have my little thing here of alcohol. So when you see me continuing to touch things, just know my alcohol container is sprayed. Everything is sterilized. Okay. You can see I'm getting a really good treatment on here. I'm going to go right under the chin. And you'll see that this is starting to get a little goopy, right? Leave that alone. Don't try to clean that. Don't try to do anything with that. Somebody just said, is there a RF microneedling pen on Amazon? I don't believe so. Those are in-office treatments like Morpheus 8, like I'm trying to think of some of the other names, the newer generations of those that are coming out. They do not have, to my knowledge, an RF microneedling device on Amazon. Somebody said, Lisa said, my forehead feels so sensitive, but am I able to bear the jaw and chin? That's the reason why. So let me just reread this, Lisa. My forehead feels so sensitive, but I may be able to bear the jaw and the chin. That's because you've got so much more anatomy underneath here. There's muscle, there's, flesh, your skin is thicker. When you get up to your forehead, look at how thin this skin is. In addition to there not being a lot of other thicker anatomy underneath there. Yes, you have muscles. Yes, you've got blood flow. Yeah, you have all of that stuff, but not to the same depth and thickness that you do on the lower part of your face. That's part of the reason why you're able to go thicker on the thicker parts, and the thinner skin without the anatomy underneath it, you need to change the level of your needles. Okay, what exactly does hyaluronic acid do? Hyaluronic acid, it's a moisture attractor. I can't think of the name right now. It's just like blanked me. But it attracts moisture, and so it naturally occurs in our skin, which is why I like to use it. Anytime I'm going through the barrier, that skin barrier, I want to use something that is naturally occurring in my body so that the rate of, or the likelihood, I should say, of there being any irritation, sorry, I'm getting tongue-tied, or, you know, any sort of, yeah, irritation or any sort of thing that's going to slow down the way that you're healing. You want to make sure that there's no scent in it, there's no active ingredients in it. Active ingredients meaning things like acids or retinoids or vitamin C's. Those are going to increase your irritation of your skin, which we don't want to do. Okay, so again, I'm still at I'm going to turn this up a little bit. I'm going to 0.75. I'm going to go to a 1.0. Yep, turning it back on. Again, you see all the goop and stuff there? You'll see little tiny droplets of blood. Well, it just turns pink because there's little tiny droplets of blood. And you can see it on my face, right? It's not dripping. It's not super intense, but there are little tiny droplets of blood that get mixed in with the hyaluronic acid. So you get like this pink goopy thing. Leave it alone. Don't touch it. Oh, here's what I was looking for. Oh my gosh. Okay. I just want to make sure that I have this sprayed. I've got like a tissue sprayed here next to me. So anytime I want to just put my hands over there, if I touch something that I feel is not completely sterile, I just have something that I'm continually wiping my hands on. And if this part bugs you, if this goopy part bugs you, you can do this. You can, on the outside, just turn the device so that you get that on the tissue. Do not go inside this device at all, and make sure that when you do that, that you're doing it with some alcohol sprayed on the thing. But otherwise, just leave it. The needles are going through that, right? The needles are going through that. It's not hindering your treatment at all. Okay, so now I'm at a 1.0. I'm going to get these cheeks. And I normally do 3 passes. Yeah, I normally do 3 passes because you want to make sure that you're treating that. You don't really need to make sure that you're treating it evenly. I just like to make sure that I'm treating it evenly so I don't miss any spots. But it's sometimes I think on the first pass, it warms the skin up. Like it kind of starts making those channels, and you can see that it's starting to turn slightly pink. But to go back over it a couple more times, you're going to get a much better treatment. So when you look at my microneedling protocol, you'll see that on each section, so like look, if you just even look at the cheeks, chin, and jowls, the reason why this is grouped together is because this thickness of the skin on most people is generally the same. So you'd use the same needle lengths on this. The nose is trickier, the lips are trickier, the eyes are a lot thinner, the forehead's a lot thinner. The neck has a different type of skin. So I change what I'm doing in terms of the needle lengths, the technique that I use, whether it's a swirling technique or a stamping technique. A lot of times on the eyes or the nose, things like that have a trickier anatomy, more curves to it, I'll use a stamping technique where I'm lifting the device up and putting it back down, as opposed to a swirling technique in which you do not lift the device from the surface area. You're just using that hyaluronic acid as a slip, and creating those little teeny tiny circles. You can also do it in straight lines. You can do it like you're mowing a lawn, right? You can absolutely do it like it's mowing a lawn. I just found that the circles for me help me a little bit better. But yeah, you'll see that the speed of the device changes, the number of passes, the type of technique that I do, along with the needle lengths for those certain types of the certain areas of the skin. It hurts me on my forehead too. You know where it hurts the most for me? Yes, the foreheads, but up here on the occipital bone above the eye, because that automatically will make my eyes water. I'm just going to get to the, I can't handle it. Sarah said, I can't handle it. I need to use numbing cream. And Sarah's a nurse. But that's okay, Sarah. Everybody has a different pain tolerance. And honestly, I think your pain tolerance increases with age. So I know Sarah's a little bit younger. But when you get to be my age, it's like you've been through some pain in your life. And so you tend to like be able to handle pain a little bit better, or a little bit differently, I would say, a little differently. You'll also notice like when older people start having those aches and pains and you get to like that really old age, which is 85 and older. That's the oldest old category. The oldest old category is 85 and older. And when you get to that age, things don't hurt necessarily as much as they do. And maybe that's a deadening or a lack of communication with neurons in your brain, right? Like there's just a lot of other stuff going on. So I might be able to handle pain a little bit differently than somebody who's like in their 20s or 30s. This is, oh, thank you so much. Always something real. Thanks for tagging somebody. You guys, if you're learning anything from this, hit that little button on the bottom. It looks like a paper airplane where you send it to a friend. Send it to a friend, right? If you know of somebody who's spending $500 to $1,000 to do microneedling treatments in office, and you've been telling them you can do this at home, send this to a friend. Hit that little airplane button in the corner down there. And send it to somebody who you think like, oh, this is who I've been trying to tell you about. Okay, let me just scroll up. Does it hurt anymore when you turn to the same spots over and over again? It doesn't really, I mean, not really, because you're already warming up. You're already kind of used to it. It's the very initial, let's start microneedling. That's that's where the most pain comes in. It's that fear of the unknown, of what is it going to feel like. So I always tell everybody, when you start on doing this at home, start low. Start at, I would do a 0.25 millimeter. That is nothing. 0.25 is very, 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 you might start doing this and go like, I don't feel this at all. Is this doing anything? Do your whole face like that. And then do a full one pass like that. And then maybe step up to a 0.33 or a 0.5. If you did your whole face in just a 0.5, you are getting a great treatment. I know of a Zeo Skin Health, it's not necessarily Zeo Skin Health, but there is a spa in North Carolina that is one of the highest sellers of Zeo Skin Health products in America. And their bread and butter in that spa is bringing people in once a month, so every 4 weeks, doing a 0.50 millimeter, which I do at home all the time, not more than once every 4 to 6 weeks. Every 4 to 6 weeks, you guys do not repeat treatment earlier than that, because you're exhausting your skin. You could be causing inflammation, causing more harm than good. Every 4 to 6 weeks, let your skin heal first. Let it heal before you do it again. But there is a spa in North Carolina that is the biggest seller of Zeo Skin Health topical skincare. And their bread and butter is bringing people in once a month. They sign up for a big program once a month to do 0.50 millimeter of microneedling. That's all they do. And then they put on top of that, it's not what goes on top of it, but they put like a growth factor serum on top. They use all the Zeo Skin Health products, which are outstanding, by the way. But they put that on top and they bring them back in the next month and do a 0.50 millimeter microneedling, and that's what they do, and it's creating beautiful skin. $500 to $750 per treatment. $500 to $750 per treatment, and that's in North Carolina. You do like a microneedling here in Los Angeles, and you're looking at $500 to $1,500. $1,000 is like a good kind of average here in Los Angeles to do this in office. The device itself is under $200. All of the stuff that I do with it, including extra needles and all of that, you could do that all for, you could, in 1 month, you will have paid for your treatments for the year. In 1 month. So, can you do this stuff at home? Yeah. Is it safe to do at home? It is if you know what the hell you're doing, right? If you learn a little bit, if you watch these tutorials, if you've got somebody to guide you through it, and you can get over that fear. And a lot of people, they can't get over the fear, and that's okay. I do a lot of one-on-one coaching through Zoom, where I'm doing this in a Zoom, and you're on the other side with the same device, with your needles, with your hyaluronic acid, with your alcohol prep wipes. You're all on the other side of that, and we're doing it together. That is something I do all the time. So if you're afraid to do something like this, you're not alone, my friends. You're not alone. There's a lot of people that it takes them a lot of courage to get up, to do something like this, because you're literally having needles go in your face on purpose. On purpose. So that's already, that whole concept is like, that's a lot. It is a lot. But I'm telling you, it will change your skin. You get used to it. You get over it. You do that first treatment at a very low depth of like 0.25, and automatically, I can tell you right now, when I've got skincare, when I've got one-on-one coaching clients and they're coming to me for microneedling, we do not spend more than 2 sessions. Sometimes it's 1 session and they are off and running, and my job is done. And then they'll hire me for coaching for some other stuff, for weight loss, for, sleeping better, for hormones, whatever it is. But when I'm dealing with a client who their main concern is they want to be able to microneedle, a lot of times it's 1 session with me. So it's that initial, I'm going to put this on my, where? I'm going to do what? It's that first initial fear. And once you get over that, doing these type of things at home is going to save you a ton of money, and you're going to get better results, because unless you've got money to burn to do in-office treatments, unless you've got money to burn, you're going to be a lot more consistent with your treatments if you've already got the device. You've already got the device, and then you set up a system in which consistently you are held accountable for what you're doing. And then like, okay, every Sunday I'm going to microneedle. Not your face, but every Sunday I'm going to microneedle a different body part. By the time you get back around to your face, it'll be 4 to 6 weeks. It's been 6 weeks since I microneedled. And I did it on camera with you guys. It's been 6 weeks since I microneedled. So that's at the further end for me. Normally it's every 4 to 6 weeks, but I've been doing a lot of traveling. But yeah, if you incorporate something like this in a way that it's part of your weekly routine, and okay, what's Sundays? For some people it's church. Some people it's church and microneedling. Some people it's microneedling. Some people it's like, you go on your long walks. Whatever it is, if you find that 1 day a week, I promise you, by the time that you get around to doing it again, you will have gone through the different body parts where you feel like, oh, my skin is a little thinner here. My skin is getting a little crepey here. Or I'm having like discoloration. Or you're seeing like some crepiness, different things like that. By the time you get those body parts done, you go back around, you'll see that it's like every 4 to 6 weeks. For me, I'll tell you what happens. On Sunday, I microneedle my face. The next Sunday, I might do my abdomen. The next Sunday, I might do my neck and chest. The following Sunday, I might do my knees. Whatever your concerns are, which might be different than mine, pick those body parts, 4 to 6 of them, that you feel like I want to work on this for the next few months, few years, whatever it is, and do that consistently so that when a Sunday goes by, or whatever that day of the week is that you have, said that that's when you're going to do it. When that passes, okay, I got to either catch up on that, or I have to be more consistent with that. And consistency, even if with a lesser treatment, you can see I'm going to go back over. So if you look at my face now, you can see I've got a nice treatment here. I'm going to go back over this, and then I'm going to change the depth. You can see I haven't done anything here. I'm going to change the depth and do this a little bit more shallow, but I'm going to go over this other side. Does that make sense what I'm saying, everybody? Okay, and then to get that microneedling, listen, to get this whole free guidebook, you can do one of two things. You can go to liveyounglifestyle.com and click on the menu and go to protocols, and you'll see all the protocols there. You'll see the free retinoid guidebook to figure out which retinoid is right for your skin. There's a younger eyes protocol in there. So this shows you microneedling is my top way that I get rid of crow's feet and fine lines and wrinkles, and to thicken up this eyelid, this crepey eyelid I have. Now listen, I've had work done, you guys. I talked about, I had my plastic surgeon on a couple weeks ago, and we talked about the neck lift that I did. But I have not done anything to my eyes. This is no lower bleph, so I've not had any surgery on my eyes, and no upper bleph at 56 years old. And I'm telling you what it is from. The reason why I do not have like etched lines, number one, is Botox prevention. I've been doing Botox since I was in my early 30s. I'm 56. That's a long time to be doing Botox prevention. But honestly, the next best thing, and in conjunction is always better, is microneedling. And this has really helped to resurface and fight those fine lines and wrinkles, but also the crepiness involved when your skin thins. If you've got somebody in your life, or maybe it's you, where you run into something or you nick something and your skin just bleeds, it becomes very thin and crepey with age. That is part of aging. Part of that is estrogen decline. So if you're menopausal, if you're over the age of 40 and you're not on hormone replacement therapy, your skin is going to thin. It's going to thin at a faster rate than somebody who's on hormone replacement therapy. I've done many lives and had many doctors on here talking about hormonal health. In fact, the last one I did was, what was that? Was that last week or a couple weeks ago? Oh my God. It was either last week or a couple weeks ago that I had hormone specialists on there and talking about all the various symptoms of estrogen decline, which is perimenopause. That's when that starts happening. And it can happen as early as your 30s. So if you're 30 and you're noticing like, oh my gosh, my skin is thinning, it's getting dry, go get your hormones checked. Because it's not just one direction in which we address things. You're always going to get better results if you're addressing it on multiple different fronts, right? So if your skin is thinning due to age, one of the top ways to thicken your skin is through microneedling. It actually thickens your skin. So do I microneedle my arms? Absolutely. The back of my arms? Yes. My chest, my neck? Absolutely. My crepey tummy skin? Yes. The knees? 100%. So it's all of these different things, the different body parts, and your skin is not just your face. So I do this on various body parts, any part that I feel like, well, that's a little bit crepey, or that skin is getting a little bit thin. Microneedling, for sure. It's that and retinoids. Those are the two things that are scientifically proven. I'm gonna do one more pass on this. Scientifically proven to thicken your skin. Retinoids and microneedling. And then because, hormonal decline thins your skin. By getting on hormone replacement therapy, that's also going to help with your skincare. Okay. I'm going to change the needle length now. I'm going to get a little bit more right on this area of the chin, right closer, a little bit closer to my lip area. Somebody said, hi, I noticed whiteheads the next day after microneedling in the same spots in my face. Can it be because I overdid it? I would ask you, what did you put on your face afterwards? Because if you're putting on too thick of a layer of Aquaphor, this one is CeraVe Healing Ointment, but normally what I would do for the post-care, and I was going to go over this, I carry around the hyaluronic acid and continue to apply it for a couple of hours. In addition, I'll also spritz like a mineral water on it to keep it moist. And then when I can't stand it anymore, then I will rinse all of that off and apply a thin layer of Aquaphor. So if you're getting what they call, I think it's called milieu, it's those little white bumps, it could be because you're overly sensitive to Aquaphor, or it's creating like you're putting on too thick of a layer. I would try Siha.it. I would try doing it without the layer of Aquaphor and just when you're done after a couple of hours of reapplying, rinse it with cool water and leave it alone. Leave it alone. Don't put any layer on top of it. Don't put anything. Leave it alone. Let's see what happens then, okay? Part of the post-care too, you guys, is I heal very quickly. And the reason, let me just shut this off for 1 second. I heal very quickly. And the reason is because I do multiple things, right? Like I said earlier, it's not just one thing that you should be doing that's going to help speed your healing. Does sugar speed your healing? No. So do you want to eat a predominantly plant-based diet? Good sources of protein, obviously, yes, but you don't have to go and eat protein shakes or anything like that. You can get a lot of protein through plants, and I did a whole live show on what I eat and how I get plenty of protein in plants, but I do microdose my meats as well. But yeah, you want to have a healthy diet. You also want to, because we are making collagen. So think about this for a second. We're making, in fact, I'm going to just turn this down and keep going because I want to make sure I get this whole treatment in. And I got a little ways to go. Okay, I'm going to do a 0.50 around the mouth. And then I'm going to talk about post-care. When you're talking about post-care, like I said, I always add a layer of Aquaphor, and I will keep that layer on. And I mean thin, not a big goopy thing, a thin layer of Aquaphor. And when I keep that Aquaphor on, I don't rinse it off at night. I'll sleep with that on. A little layer of Aquaphor. And the next day, all those little holes, everything is like all closed up and good. And I'll have like a few little marks, but not bad. But I'll be taking some stories the next couple of days showing you day 1 of microneedling healing, day 2 post microneedling, day 3 post microneedling. I'm going to do all of that. But one of the big things that I do that helps me to heal a lot faster is I double up on my red light therapy treatments, which if you look at my story I did today, I did a bunch of stories on red light therapy. I do red light therapy every day, but I do use the mask and double up on my treatments the few days following a microneedling session, because red light therapy heals the skin faster. Also, because we're tricking our body into producing its own collagen, we want to make sure that we have all the precursors in our body to be able to make those. So that's why diet is super important, but also a collagen supplement. This is my favorite. This is by Modere. They've changed the labeling here. So it used to say hair, skin, and nails. Now it says beauty. But this is the latest one by Modere. You can just DM me or comment the word collagen and check your DMs. They'll get a link to my favorite collagen supplements, but I double up on my collagen when I'm healing. Normally I take a tablespoon of this in the morning and a tablespoon at night. I take this every single day. But when I do a microneedling treatment, I will double up on this. So I'll take 2 tablespoons in the morning and 2 tablespoons in the evening. In addition, I also add, let's see if I have it. Yeah, I also add my hair, skin, and nails. This is my brand, Live Young Hair, Skin, and Nails. You can comment the word supplements, or you can go to the website and click on the Shopify. So the website is Live Young Lifestyle. The Shopify is shop.liveyounglifestyle.com. And this is a collagen generator. So I want you to think about this for a second when it comes to healing. And when you see my stories and you see how quickly I heal, I want you to kind of just wrap your head around this for a second. I'm creating traumas, right, which are calling my own body to produce collagen. Let me just wipe off my blood gunk. 1 second. I'll just wipe. I'm just going to, again, I'm taking that's sprayed with alcohol, and I'm just twisting this in there so it just gets the gunk off of the outside. I know that's really gross. Okay. So when we're doing this, I'm creating the traumas, which are calling on my own cells to produce collagen and elastin, right? To diminish fine lines and wrinkles, to help with melasma, even out skin tone and texture, helps with blackheads and whiteheads, helps with acne, all of this stuff, tightens the skin, all of it. When I'm doing that and I'm causing my body to call on its own cells to produce collagen and elastin, I want to make sure I have the precursors there. I also want to make sure that those cells responsible for producing collagen are nourished, and that's what this does. This is the Live Young Hair, Skin, Nails Collagen Generator. So it's not the same as this. This is collagen, which gives me all the precursors necessary to build that collagen back. So I have all of those in my system. This is a collagen generator, which nourishes those cells and stimulates those cells that are producing the collagen from the traumas I'm creating. And then I double up on red light therapy. So think about that, creating the trauma, nourishing the cells that produce the collagen, having all of that in my system, all those precursors necessary to build it back. So I'm hitting it on multiple levels when it comes to healing, right? And when it comes not only healing, but when it comes to generating that collagen. This is generating collagen. This is allowing my body to generate collagen because it's giving me all the precursors. And then this is actually stimulating my skin to produce its own collagen. So there's a lot going on here. And then I double up on this for healing as well. I'll even double up on this, and I'll double up on my red light therapy. Okay, moving on. I want to make sure. Yeah, so Lisa just said my needle cartridge gets full of hyaluronic acid and blood. I guess, do you need to change the cartridge? It goes straight through there. You do not need to change the cartridge. And just finish your whole face. So I'm gonna do my forehead now, because I'm gonna put this down on like a 0.50, which I think I'm on. I am on, yes. Okay, little swirls. You just keep on going. I only like took some of this off the outer edge because I didn't want you guys to look at the gunk and be like grossed out, right? But otherwise, I just keep on going, and I do my whole face. And then I will change the cartridge when I do if I do my neck and my décolletage in the same session, which doesn't usually happen. But if I do, say I forgot it, or I just didn't have time the week before, that is the most I will do in one session. The most I will ever do in one session is face, neck, chest. And that's even rare. Most of the time I divide those. And the reason is because you don't want to do more harm than good. So controlled microtrauma, which I'm doing now, I'm controlling the amount of microtrauma that I'm doing is good. But if you get used to this and you're like, screw it, I'm gonna do my whole body, the amount of inflammation and stress that you're causing your body is doing more harm than good. So it's not always more is more. Sometimes more will cause systemic inflammation in your body, which is actually aging. So you don't want to do multiple body parts all at one time, which is why there's a method to the madness, right? To get this free calendar, you can either comment protocol, or you can go to liveyounglifestyle.com and click on the protocols, and that's all free for you there. Okay. Little tiny swirls. How am I doing on time? I want to make sure I get to my eyes, because it is my #1 trick for crow's feet, fine lines and wrinkles around the eyes, as well as helping with the crepiness and thinness of the upper eyelid. Like I said, I've not had an upper bleph nor a lower bleph. I'm not against them. I'm just not a candidate yet. I'm not a candidate yet. So far, with the consistency that I've been using, that I've been doing microneedling, I'm going to do up my upper lip at a 0.25 real quick. I'm not a candidate for that. I've asked my doctor, like, hey, what do you think about the crepiness of my eyelid? And look, you can see there's crepiness in my eyelid. It's not enough to do an upper bleph on. You would not do an upper bleph on an eyelid like this. And at 56 years old, without having done any surgery on my eyelids at all, that is this device. That is consistently using this device. Now there's other things, sleeping and stress and exercise and all of that stuff, because it's all so related, right? It's all related. But this is the main thing that I've been doing in terms of skincare for my eyes. Okay, get a little bit of that. I'm gonna get on the side of my nose. Again, this is very light. This is a 0.25. Now this is one of the places where I like to stamp, because the anatomy of the nose is bony. So you pull to the side and you can get rid of all those blackheads and whiteheads. And then when you go down the center, you stamp. Do not stamp the tip, because when you stamp the tip and your nose actually goes into the device, you're no longer getting the same millimeter depth that you toggled this to, right? Because it's going inside the device, you're getting much deeper. So stay away from the tip of your nose and just do along the bridge, and then pull to the side and do there. Now, if you're somebody that you've got blackheads and you've got large pores right on the tip of your nose, then just toggle this all the way down. Just know if any of your body part is going into the device, it's a much deeper depth than what you've toggled the settings for. So be careful when you do something like that. Okay, I'm still at a 0.25, and I'm gonna go right under the eyes in a swirling technique. I've got 5 minutes to do the eyes. Let me see if there were any other questions. At what age did I start microneedling? I'm 56 right now. I wanna say I've been doing it for at least, gosh, I'd have to go back and look. I wanna say since I was 40? No, over 15 years? Yeah, I want to say that. What depths am I using right now? I'd have to know when that was. Right at this particular second, I'm at a 0.25, but I'm doing around my eyes. So I always go much more shallow. I love applying growth factor serum. Okay, let me just get to the end. I'm going to get to the end here. If I missed any questions, you're for the actual shock from the even skin, not stimulation, but shock. Yes, I have felt that. Yes, I have felt that, like a little jolt. You're probably not having enough conductive gel on. Sorry, I didn't mean to like get off topic here, but this is the Dr. Pen M8. Again, everything is in here, you guys. And then I'm going to really get into this on my eyes because I don't want to miss my treatment. But everything is in here. All of the device I use, all of the before, after, not before and after, but the pre-care, the post-care, all of that stuff. Okay, I'm going to just scroll down so I can see. I'm sorry if I bypassed your questions, but I'm going to see, I'll be able to see the questions now as I'm doing my eye. I'm at a 0.25. I'm using a swirling technique right on the corner. I need to make sure that I'm staying on that occipital bone. How do you prevent post-inflammatory pigmentation? When you're talking about, this does not cause that. When you're talking about things that cause post-inflammatory hyperpigmentation, it's usually done with heat. So when you look at like stuff from like melasma and things like that, and you treat, you want to stay away from heat if you've got melasma, and that will cause like a darkening of the skin. It will actually make your melasma worse. They have not found that microneedling increases that. Now, if you are somebody that keloid scars or anything that you touch to your skin, if it creates a little trauma, it creates a darkening, you don't want to do this, because this is creating trauma. You don't want to do this. But there's not, in fact, when you microneedle, there's a lot of research that shows that it helps with hyperpigmentation. It doesn't hurt in terms of causing more hyperpigmentation. It actually helps. Okay, I have to concentrate now. I'm on this upper eyelid, and I'm going to be stamping right on that occipital bone. What I do is I pull this up, because this is all bone. So I can microneedle all the way down here. Now, they would never do this in office, but if you think about this, it makes complete sense. They want to stay away from everything. They're, you know, but when you're doing it to yourself, you can feel where that bone is. So you pull this all up, and I do a stamping technique right on the upper eyelid. You can even stamp this into your eyebrow, and it will help with hair growth. I'm not going to do that now. But I'm going to do this upper eyelid, and I'm stamping. This is where my eyes are going to water. Blah. Okay, keep going. It's not the pain that that's making me stop. It's like there's a little bit of air that happens with the movement of this, because you think about it, it's literally pushing the needles, and it creates like a little bit of air, and that when that air gets into my eye, it causes my eye to water. Okay. Now you can see there's a little bit, this is at a 0.25, you can see the little droplets of blood. Does your protocol list include stamping the scalp? It does not, but for craft's sake, you would do that at the same amount of time. So in other words, I will stamp my scalp, which will help with hair growth, and I'll use a stamper like this to do that. This is the Dr. Penn stamper. It goes up to, I think, 3 millimeter. It goes up to 3 millimeter, and you can stamp. This is all you know, completely sterilized, but you can stamp this in your scalp and stamp your whole scalp with it, and it really helps with hair growth. And I don't have that on the protocol because not everybody would end up doing that, and I do that probably, I want to say every 4 to 6 weeks. Every 4 to 6 weeks. Okay, I'm getting right underneath here. Again, I'm still on that occipital bone. I can feel the bone. Look, this is all bone. You don't want to go on your eyeball, obviously, but you can get much closer than what you think that you can. This is all bone out here. Look at how close I can get to my eye out here. Make sense, you guys? And then you can also do in here in the bunny lines, right on that bridge of the nose, on the inner bridge of the nose. Okay, go to the other eye. And again, if you are, when I post this to my main feed, which I think I'm going to do, when I post it to my main feed, if you just comment microneedling, to make it easy for you guys, if you want to go to the website, that's the easiest thing, liveyounglifestyle.com, liveyounglifestyle.com. Easiest way to get all the protocols, because they're all there in the main menu under protocols, and they're all free, okay? But when I post this to my main feed, if you don't want to go to the website, just comment microneedling, and please tag friends, please tag your friends, please share the video with people, so that more people, you know, get to learn about how to do this at home. So please like, a lot of people, you know, just comment, and they get their stuff, but they don't even like give a heart to the video, and you've just got a free microneedling whole demo for free. So if you want, what you can do is when I post this to my main feed, just comment in the comment section, microneedling. Then check your DMs. You'll get this whole thing in your DMs. Like I said, give it a like, give it a comment, share it with some friends, and then go to go to the website and see what else is involved in there, right? There's a lot of different stuff. There's a whole written blog. There's all the TV shows I've been on. I've been on several different TV shows. Yeah, so check it out. Check all that stuff out. But you can also just comment microneedling. It'll give you that free guidebook in your DMs. Check your DMs. If you want to comment protocol, you can comment protocol. It'll give you the monthly calendar. It will ask you to sign up for the newsletter. So just go to your DMs and look. When you get this in your inbox, it's going to go to your junk mail. So make sure that you check your junk mail. It will be coming from Darnell Cox within 5 to 10 minutes of you signing up, okay? If you want the Younger Eyes free guidebook, just comment the word eyes when I post this to my main feed. Check your DM, you'll get this whole guidebook, right? That goes over not only microneedling, but it talks about which products are right for you. I think this was my, I don't even, I think that, no, it wasn't true. It'll talk about which products are right for you based on different concerns. If you have eye bags, you're going to use different products than if you've got fine lines and wrinkles. So you can either comment the word eyes or just go to the website and click on that protocol and get all that. If you want my favorite, collagen, just comment the word collagen and then look at your DMs. You'll have the link to the collagen. If you want my hair, skin, and nails supplement, comment the word supplements and look in your DMs, and that will be given to you in your DMs. You can also go to shop.liveyounglifestyle.com. Okay, let's see. Oh, no, I started a little bit late today, so I've got a few more minutes. I will have done this whole thing in an hour. Okay, I'm pulling this up, and I'm going to stamp. I can't look at your comments right now because I'm really close to my eyeball. I swear to you, you guys, this has been the biggest help in the crepey eyelid. When my eyelid starts getting crepey, before I even look at my calendar, I could be like, oh, I think I need to microneedle. I'll look at my calendar and go, yep, I need to microneedle. And it tightens that whole eyelid back up. So the full results of this are like in 2 weeks. But your body will still keep healing. So do not, even though it feels like you're completely healed in 2 weeks, do not do another treatment until it's 4 to 6 weeks out. 4 to 6 weeks out, you guys, okay? You can do a different body part. Okay, I'm gonna get right in here. Okay. All right, let me see if there's anything else. For those of you who just joined, I'm gonna post this to my main feed. This is a full face microneedling tutorial. You can comment the word microneedling and it will get you my totally, completely free guidebook on how to do this at home with your, the needle links and all the different stuff. Yolanda just asked, what if you already have a crease in your eyelid? It's okay. You pull it up, you microneedle. You pull it up and you stamp. That's all right. It's going to tighten that up. It's going to increase the thickness of your skin and tighten that up. I would say, you do not want to do any sort of microneedling at home if you're under the age of 25. But there's no limit. There's no age limit in terms of how late can you start. If you're 60 or you're 70 and you've got a crease in your eyelid, I'm telling you it's going to improve it. Creative Eye Candy said, wonderful, thank you. Starting to feel human again. Yes, good for you. Okay, everybody, that's it. Have a great rest of your Sunday. I will be doing stories in terms of the healing of all of this, and I'll see you guys next Saturday. I have a special guest next Saturday. It has to do with diet and nutrition. I will let you know who they are. I want to make sure I confirm them first, and I'll see you next Saturday for another Instagram Live at noon. Okay, everybody, have a great day. I'm going to post this to my feed. Please give it a thumbs, give it a heart, and share it to some people. All right, I'll see you guys next week.